Good evening. I'll call the December 3rd Health and Human Services Committee meeting to order. Before we go into our presentation, I'll just ask if there's any additions, corrections, deletions to last month's minutes, which I very grateful to the chairwoman the former chairwoman who stepped in to run the meeting. You barely had a meeting. And also thank you, Mr. Dodo, for coming in at short notice also. And Mr. Gray, of course. You could have, I could have drafted you to come help me at the barn if you had preferred, but. Seeing none, we'll take the minutes as presented then. And at this time, I would like to ask Mr. Stephen Jennings to come forward to do a presentation updating us on the overdose situation which we've been having occurring within our county in the recent weeks, months.
Thank you. Good evening, everybody. Happy to provide you an update on the overdose situation. Let's see how this works. So we are monitoring data on several fronts. We're looking at patient data, and the state systems and the hospital systems are refining their methods every day. We now have a daily syndromic surveillance system in place that the hospitals are entering data into. Of course, we have the fatality data through the medical examiner's office, which is at Public Health. And then we have what we're calling incident data through a new surveillance system called OD-MAP that first responders are using in our communities, and we'll talk about that at the end of the presentation. And we do have a very active overdose response team, and I will tell you about that at the end of the presentation and who's on it. So patient data, obviously hospital emergency departments and inpatient admissions. We have treatment program admissions and reported naloxone administrations. That's Narcan, reversals. Not all of that gets reported because many civilians are using it, and all of that is unreported. And all of our first responders are not reporting, but we have the data on the ones who are. The incident data comes from law enforcement, EMS calls, OD mapping. As I said, we're trying to get this off the ground. Not everybody's using it. We'd like every first responder to use it. And then, of course, the death data. And there's a lag time in getting cause of death because we have to wait for toxicology reports. We did have quite a number come back today, so I'm going to update you on those. If I can use this. So overdose types, we divide them into illness and death. The illnesses would be those that go to the hospital and the emergency department, those who go into treatment that we know about, and the naloxone administrations that we know about. All are indicators of the levels of illness in our community. And then, of course, the deaths, which are deaths. For total overdose illness, for 2019, you can see the dark blue line that kind of goes across the top are the emergency department visits. And you can see that we actually had a spike there over the summer. The light blue line are those who were transferred from the emergency department that either went into inpatient hospital or to a treatment program somewhere in our region, or very often they go out of state because we don't have the resources. And then inpatient data, and this is for total overdoses. So this would be for everything including opioids, but it could also be for alcohol, cocaine, any substance. When you drill down just to opioids, we actually have seen a decline in emergency department visits. And I would just note here that this slide has a slight error. It's actually through November of 2019. When I created it, I didn't have that data yet. I had it today, but I forgot to change slide. But the numbers are plotted in there, and still you see a reduction in emergency department visits. Heroin ED visits seem to be declining, as well as all other opioids. But when you look at inpatient hospital visits, you see a rise. So where ED visits dropped, inpatient hospitalizations have increased, and you can see a rise in non-heroin opioid overdoses really increased since 2017. And I think that bears out too in the death data I'll show you about what we're seeing. Yes.
Did the visits slow down because more people are carrying Narcan and they're not going?
Could be. Or they're dying. Yeah. It could be a combination of all those things. And we thought with our death data, we have seen quite a reduction over the last 2 years until this last quarter. And we had attributed that to all the services that have been put in place. And the services are very active, more so than ever in terms, I know through the Anchor Recovery Center. I don't have information on other services, but I hear they're active. And I can get that data for you. I didn't get it for tonight. Could be. They don't get into these statistics. They don't fall into these statistics as reported. So that could be, but the medical examiner, so on the toxicology reports, we're looking at all substances in the body so we can see what's there. And the medical examiner will know if the substance caused the heart issue. We reviewed a case yesterday that was deemed an overdose, even though the death was a heart attack or cardiac event. Yes, and I don't know the death certificate. They're amended. They're always amended, yeah. Yeah, because we're usually getting them back after the burial. So. Yes.
So my question earlier, you said that a lot of the first responders are not using the OD map. Why is that? I remember last year when you were here, you talked about that, and we discussed how they make or
so it really started, I believe, this year. OD map has really gotten off the ground in Jefferson County. Other communities in the state and the country are using it. OD map is used by HIDA communities, high intensity drug trafficking areas. Jefferson County is a HIDA. And so there are HIDA representatives here in the DA's office, I believe, and we have Syracuse representatives, and there's one from the North Country who come to our meetings. And so we're getting it off the ground. More and more are using it, but they are not all using it.
So what you're saying, it's a new process, a new system. Is there something that we can do to help? Is it a funding
There's
issue?
not it doesn't cost anything. It's just their time. They enter in data through the web, so they can do it back in their vehicle and their device. And it's very basic information that gets entered. And that information is what initiated the alert yesterday. We used OD map. So Tiers, South Jefferson Ambulance, and Town of Watertown are the agencies. I don't want to feel like I'm ratting them out because they're all kind of getting there. But those three agencies have been really doing it across the board. The others have been hit and miss, and we have others that aren't doing it at all. We'd like them all to do it, obviously. Because this information is really more meaningful and impactful. We can report on the hospital data and the ED data, which we will, and the death data, but it's almost like too late. If you can get that real-time information about what's happening and where it's happening, that's what we want to get out to the community and hopefully try to save some lives. Yep. Guilfoyle, I believe, is they're not participating. I'm not sure about the others because it's an evolving process, and I don't want to point fingers at them. It's not like you can turn a switch and get everybody to do it on day one, but they're all being educated. We definitely want them all to use it. Any other questions? I'll keep going. So treatment programs, the state information comes from the State Health Department. These are the unique clients that were admitted to OASIS Certified Chemical Dependence Treatment Programs in 2017 and 2018. And we just wanted to show you, give you the numbers of the people accessing these programs. And these are for opioid use. And you can see that most of the clients were admitted for heroin use, about 75% each year. And the other clients admitted for other opioids. And those numbers to me are significant for Jefferson County. Reported naloxone administration, so EMS and law enforcement can report, and also community opioid overdose prevention programs, or COOPs. The only one that we know of that's operating here is ACR Health, and so they can report in to the state, and this in no way represents the actual number of naloxone reversals happening, because we just, the ones where civilians are doing it are never reported, and not all first responders report. So it just gives you an indication. Not unsurprisingly, you see more activity on the EMS front. Law enforcement's light blue, and then the COOPs are magenta. So yeah.
Just a quick question on the civilians that are using it. They have to get them refilled. How are they doing that and somebody not keeping track of their refills? How are they getting their hands on? They dispense one or two. They got to obviously replace it. Who's replacing it and keeping track of that?
So I know through the Anchor, which is where many people go to get it, and they can get it for free, and they can get training for free. They're keeping track of that number. Other agencies, I believe Kratos distributing it. I'm sure they're keeping track of their numbers, but we don't know how many are actually getting reversed with it. But I could get that information for you, just to have a sense of the inventory. People can also get it at a pharmacy.
But they have to pay for it there, correct?
I believe so, yeah. So overdose deaths. These are total overdose deaths since 2010, and in Jefferson County. And so you can see the dark blue numbers are non-opioid overdose deaths. That could be cocaine, it could be, whatever, that's non-opioid. It could be alcohol, and sometimes it has been that. The light blue is opioids, and then the 5 in 2019, just updated today, we now have 5 pending toxicology. So I just wanted to give you a lay of the land across all these years of particularly the opioid use on our community, which is significant. This is the percent of opioid confirmed deaths. And so, year to year it's not that many numbers, but we wanted to demonstrate here how heroin and fentanyl have grown. Up until today, the 2019 slide was all heroin and fentanyl, and we added 2 cases today. One was cocaine, and the other was, I can't recall what the substance was, another non-opioid. I think it was methamphetamine. So clearly, these types of drugs are impacting our community, bearing out in the types of hospitalizations, obviously, and then in the death data. And you see over and over again fentanyl. These are the confirmed pending overdose deaths in 2019 through the medical examiner's office, and we just wanted to demonstrate we've had this huge spike in the last quarter. Prior to that, we were just having staggered cases, one every other month or so. And then it really picked up, unfortunately. So who are these people? Of the 11 confirmed deaths, the average age is 35. The youngest was 25, the oldest was 50. There were 9 males and 2 females, which is typical. There tends to be more males. And where they occurred, 5 in the city, 2 in Carthage, and then 1 each in Luray, Champion, Town of Brownville, and Village of Brownville. So we typically see more of a concentrated activity in the city, and then around it. Many people think it's kids dying, and kids don't use heroin, or they're not using enough to die yet, hopefully. Or it's soldiers. Occasionally we do get a soldier, but that's not typical. So OD Map. So it's a web-based overdose detection mapping application software. It was developed in the Washington, Baltimore area for the HIDA that is there, and it's now being implemented nationally. We're a designated HIDA, and so we can use it. And it gives near real-time suspected data, and that's what we had Monday. So we could tell Monday where they were, the number. We could tell what the suspected drug was because the first responders put it in. And there wasn't a theme on Monday, really, other than opioids. It was fentanyl, and it was heroin, and it was oxycodone from case to case. Now, most people use a number of drugs at once, so fentanyl could have been used. But as we get better at it, maybe we'll be able to see those types of things and send out a warning. 4 of them were in the city, 1 was outside the city, and 1 fatality. ODMAP can be used by government agencies, or coordinated, I would say, by government agencies only, because skilled players can use that. But it's coordinated by government. Again, it's free. These are the types of things they would put in. It's designed to be easy for the first responder. Location, date, and time, a little bit of case information, the overdose type, whether the person died and was naloxone administered, and then they submit it. And that's it. What's that?
How many die in the presence of the first responders versus being transported and then dying in the emergency room?
I don't know. Yeah. Anecdotally, many times they get there and the person has died. That's what we hear. This is a screenshot of what it looks like. That's Jefferson County. And you can actually look at all of New York State and all of the United States. And so this is great information. It's telling us where the fatalities were. This is from January through, I believe, the end of November. Whether a single dose or multiple dose of naloxone has been administered, all kinds of information that we can use to get better at this. So it's an illustration of, there's only 60 total suspected overdoses. We know there's way more than that. That's why we want the first responders to enter this data. If you're in your jurisdictions, if you could ask them to, we'd appreciate it. And we can certainly help them. And then we have a very active team working on this. We meet every month, and we have a lot of emails in between. And here's the membership. It's every county department that you could think of that would be involved, obviously. and it's the department heads that are involved, and sometimes their staff. So we have a very active law enforcement presence, which is very helpful. I think we help them with the information we can provide expertise on, and they can help us. So all these folks are there. We do have HIDA representatives in the county, north of us, and in Syracuse, who usually attend the meeting in person or on the phone. And then the National Guard. And the Anchor Recovery Center is there because we're trying to, when first responders go to a scene, if we can connect them to the anchor, we want to do that. If we're able to, we want to leave information with them or developing education to leave at the scene. If someone isn't receptive to talking to someone with the anchor, they're still going to get all the information. Whether they read it or not, they're going to have it. Those types of things. And the anchor folks are also now embedded in Samaritan's emergency room along with NERCL. If a person gets there and is receptive to come to the anchor to help them get treatment or services or whatever, we're doing that right now, and that seems to be helping. We're trying to hit it from every angle, and we're trying to save lives. Yeah?
What's the criteria to be a high-intensity drug trafficking area?
I have no idea. Yeah.
So it has nothing to do with the density population, how many people
I
live
don't
here?
think so, and it may have to do with arrests that occur, or...
It would seem like it'd be per capita. I mean, if you have 10 arrests here and 10 arrests in New York City, it's a lot different, or 100
Right.
here and 100 here, you know what I mean?
Right. I'm sure District Attorney Mills actually knows the answer to that. I can find out
Thank you.
how we did that.
Right, Steve, I think Mr. Montejoe's question kind of piggybacks on what I was speaking to you before the meeting started too, is that the other counties surrounding us have also seen unusual spikes in overdose and deaths around the same time period as we have. And my question was, is there a way for law enforcement to be able to trace that back around to a source of where the pipeline of drugs is coming from? And I guess specifically, if it's fentanyl, then that means this is tainted drugs then, correct? Is that
Could be.
what causes this, or?
It could be. There's a theory that the fentanyl that's in the community now, and it's probably true, is more potent. And so the impact on people is more devastating. Yeah. But with OD-MAP, we can see, as I said, all of New York State and all of the nation. So you can track, I don't know how they did it in the EMS office. You can kind of see all the pins kind of move. So kind of drugs are heading north. So as we get better at the system, maybe we can sense what may be coming and tracking that and getting in touch with folks and seeing what the substances are. Law enforcement says we have a significant cocaine problem here now, and methamphetamine is on the rise too, which bears out in the news reports.
Mr. Navawanic.
Thank you, Mr. Chair. Steve, with this issue, I was at the NISAC conference. This was a couple years ago, and I think it was the gentleman from Erie County speaking about it. And the one thing that I just walked away with shocked and amazed at is, like, they would stamp the heroin, the packages, and in the community, it was identified, well, that's good stuff.
Yeah,
and
I knew you were
that
going to say
became,
that.
like the go-to drug. Well, that guy overdosed because he didn't know what he was doing. Are we in Jefferson County experiencing the same situation, that they're not afraid that their friend or someone on the street two blocks over just OD'd?
Right. So I hear that same thing anecdotally in my work for the Anchor. they do chase the harder substance, and they want to use it, and
They are attracted to, Mr. Gray, they're attracted to the one who overdosed on it.
Becomes labeled on the street as, in their world, quality. So they go after it. They go after it.
See,
But the problem you get into is that a lot of the, probably for lack of any other term, inexperienced people, or the danger you got, and I'm sure Mr. Jennings will tell you, is people that have been clean for a while or in prison for a while, and then they come out, and then they go back to the same utilization that they had previous, and that's
and then that's it.
That's number one. Or number two, they get their hands on something that is laced, which is a lot of what's happening is it's laced with something, and they don't realize that it's been cut with something else. So whether it's the pill-making operation that we have going in Jefferson County now, or marijuana is laced with it right now, everything is laced with fentanyl. So it becomes very toxic very quick to somebody, especially if somebody hasn't used in a while.
So the sheriff's department and the jail are very active in our work too, and trying to help people become educated before they get out. So that's an ongoing process too, and I believe there may be some folks embedded over there from Credo.
That is the value of if there was any hope, Vivitrol being mandatory before there's release from prisons or county facilities, because these are the people that are most susceptible, to going back to their previous activities. So Vivitrol at least holds them for 30 days.
Right.
So.
And they don't know anything else.
And with the Braille reform situation, they don't even get through the door to get help, is what it would seem too. So that'll be interesting to see how the data reflects once that's instituted. Mr. Maxon.
Thank you, Mr. Chairman. Mr. Jennings, do you have any numbers for ballpark on the number of people who have been admitted to chemical dependence treatment in 2019? Is that number
We don't.
up?
So
is it down?
we don't know.
Okay.
So those numbers came directly from the state health department, and it's clean data. We should know that it'll be sometime next year. I mean, there's a delay.
And is there a difference between people who are voluntarily admitting themselves, or those people who are being sent there from drug court or through the criminal justice system? We know that.
I don't know that.
Okay.
I'm sure it's a mixture.
Sure.
I maybe can try to find that out for you if you're interested.
That I would be. Thanks.
Are there any further questions from anybody?
If anybody has questions or wants information, contact me anytime. We're on this constantly, and I can try to get you information. Happy to do that.
Okay. Thank you very much, Mr. Jennings.
Thank you.
Very informative, very unfortunate, but certainly we'll keep working at it.
Thank you.
A quick question before you go, Mr. Jennings.
Yes.
Do we know where Credo stands? And Credo is the only one that's doing the outpatient, correct?
I believe so.
Suboxone. Well, there's a couple that are prescribing Suboxone, but they're the ones that are daily dosing Suboxone.
I'll ask Mr. Ritten.
Credo is the only one that's doing. Right. Do we know where Credo stands? They were maxed out for a while, though, right? They added it under providers.
running into is, this is a bigger picture perspective. Oasis is really...
Tim, would you just come on forward here, and then we can all hear you. Tim. Mr. Rudin. Mr. Rudin.
Oasis is really pushing medication-assisted treatment. All of the data is saying that we have to keep them alive before we can treat them. I mean, that makes sense, right? So Suboxone is really the way to do that. Buprenorphine is the way to do that, and methadone is the way to do that. There is a new drug, Sublocade, which is an injectable. So we're kind of working with all of that locally. One of the problems becomes, though, when a person identifies as needing treatment, whether it's through law enforcement or the court or a family tries to get them in, we have to get them on the medication immediately to keep them alive. Well, that requires a meeting with a physician, and Credo has a limited ability to do that. They can't get it within hours necessarily. It may be days before they can get that face-to-face meeting. So we're working with other providers to try to get that rapid access to the medication-assisted treatment. Working with local hospitals, we're trying to engage private practice providers to do that and really make sure that there's not a wait time. So it's really a shift in treatment perspective and philosophy at the state level because they've really recognized this is a rapidly increasing crisis.
The wait time used to be 3 weeks. Is it still the same?
No.
Okay.
You know,
That's literally, I mean, we're physically talking a lifetime for these people.
Absolutely, yeah.
I mean,
Yeah.
when they decide, if you've got somebody that's hot that wants treatment, I mean, it's got to be short of 24 hours.
Yeah, absolutely.
Or you're going to lose them.
Unless there's a real strict legal mandate, the motivation to get help can diminish rapidly, like that. Especially
Well,
once the person
you gotta
starts to detoxify.
The detox is worse than anything, and they will resort to whatever they have to
For sure,
before they
yeah.
go through the detox, which includes Suboxone.
Absolutely.
Suboxone detox is the worst.
Mhm.
So, do we know how many people are still going from Jefferson County down to Syracuse?
For Suboxone,
Yes.
I don't know.
Do we have any rapport with the clinic down there?
I don't.
Okay.
I know, but like I said, our opiate treatment program, it's been in action since, 2017, I believe. They've expanded and expanded and expanded, so they're trying to catch up. Right. 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 And this really it's the same problem that we see in just about every category of service. It's a staffing and manpower issue. It's not that we can't employ the providers, it's that we can't get the providers here, and we can't get the providers that want to prescribe medication-assisted treatment. So that it's not that we can't build that capacity, we just can't find the people to do it.
So what's the reason? An unwillingness, or is it time issues?
I think there's a few things to it. Higher level providers often don't want to come to the North Country for a variety of reasons, whether it's weather, whether it's clients, whether it's different opportunities in more urban areas. And then I think there's a stigma with working with the chemically addicted, with people who need this help. So I think there's a few obstacles that cause that issue. Now, there have been efforts to train local doctors and providers, met with varying results, but we're continuing to try to engage and come up with, as many avenues as we can.
Okay. Thank you. Any further questions? Mr. Dolo?
Just a comment, I think it's important that Public Health's been releasing the information they've been releasing to the public, because I'm hearing more and more people that are just amazed at what's happening and what's going on in the county. I don't think they realize how big this drug program problem is in our county, and hopefully we'll continue to do that and bring more awareness to these individuals that are, you know, just beside themselves. And again, the only ones that know how big the problem is, you know, public health and the other partners that are all involved in this. And it really is a huge problem, and everybody's working hard to do what they can to bring people here and get people better, but it's very overwhelming. So thank you for keeping that information out there.
Thank you very much, gentlemen. Okay. Anybody else from the public that would wish to speak to the committee? All right, we'll go into our resolutions.
First resolution this evening is amending the 2019 county budget to allocate additional state aid from New York State OMH for the Community Services Department.
Motion, please. Mrs. Fitzpatrick, Mr. Navwanick. Any discussion? All in favor? Aye. Opposed? Carried.
Amending the 2019 county budget relative to mental health programs and authorizing amended agreements in relation thereto.
A motion, please. Mr. Drake, second. Mr. Ferris. Any discussion? All in favor? Aye. Opposed? Carried.
Third resolution this evening is amending the 2019 county budget to recognize federal Medicaid administration reimbursement for the Community Services Department.
A motion, please. Mr. Dodo, second. Mr. Navwanick. Any discussion? All in favor? Aye. Opposed? Carried.
Amending the 2019 county budget relative to the Veterans Peer Support Program and authorizing agreements in relation thereto.
A motion, please. Mr. Ferris, second. Mrs. Fitzpatrick. Any discussion? All in favor? Aye. Opposed? Carried.
Authorizing agreement for provision of related services in connection with a program for preschool children with disabilities.
A motion, please. Mr. Dodo, second. Mr. Ferris. Any discussion? All in favor? Aye. Opposed? Carried.
Authorizing Jefferson County Medical Examiner's Office to accept computers from the New York State Department of Health.
A motion, Mrs. Fitzpatrick. Second, Mr. Navwanick. Any discussion? All in favor? Aye. Opposed? Carried.
Authorizing agreement for the provision of certain professional services to the Medical Examiner's Office.
A motion, Mr. Ferris. Second, Mr. Drake. Any discussion? Mr. Maxon.
Thank you, Mr. Chairman. The rates will be to be determined in the future?
Same rates as current.
As current ones,
Yep.
okay.
For the full year.
Any further questions? All in favor? Aye. Opposed? Carried.
We do have one more resolution for this evening. We forwarded to you yesterday. Authorizing agreement establishing rates for transportation service for preschool children with disabilities and early intervention infants and toddlers with delays.
A motion, please. Mrs. Fitzpatrick. Second, Mr. Dodo. Is there any discussion? Mr. Ferris.
Thank you, Mr. Chairman. I had a long talk with our chairman, Mr. Gray, about this, and understood the reason why we had to accept the other offer. And I appreciate it. It's just kind of a shame that it fell through, and the other people that were not unable to do it, I was told there was a commitment between 80 and 120 kids, and it dropped down. They couldn't afford to do it, and they could do it for less than these people, but we just had to go by the rules, which states if you can't complete your commitment, it goes to the next highest bidder. I understand this, and I'm going to vote yes on it. At the same time, it's tough, and thank you.
No, thank you very much. And yeah, it was in watching it unfold and the correspondence back and forth, but thankful that there was somebody to fall back to continue the service. I think that's the bottom line, is that the service continues uninterrupted. Any further discussion? All in favor? Aye. Opposed? Did I steal your thunder, Mr. Monticelli, or?
You've adjourned, I don't know if it's appropriate, but it's sad, the Students Against Drunk Driving, that acronym is already taken, but this is sad. That the better the dope is, the more likely people want to get to as close to overdosing as they can, and we're all scrambling to figure out how to come up with strategies to, it's just sad. Thank you.
There's always hope, though, Mr. Monticelli. There's always hope, and hold on to that. Is there, a couple other items here. Don't know if anybody had caught this in the last NISAC News magazine that was here, but our own Department of Social Services, and Teresa Gaffney was mentioned in an article within it, talking about breaking the burnout cycle in child welfare, and that points back to the work of the DSS Ad Hoc Committee and this board collectively, and wanting to invest in the technology to make our CPS a little bit more mobile and a little bit more paperwork friendly, to try to assist in their time management. So to encourage you to catch that if you hadn't. I think we also wish to recognize a department head, Mr. Fazio. I'll let Mr. Hageman take over.
Well, actually, this is Pete's last week. It's been his last week for a couple of months, so to speak, because he's been in an acting role, but this is his official last week. Pete has been working on a part-time basis, helping out in the transition. The new department head will be coming on board on Monday. So Pete's last official day will be on Thursday till about the noon hour, and then he's off into full-time retirement with his new career. We just wanted to recognize Pete and thank him very much for 22 years of service. So thank you very much, Pete.
So thank you very much. Thank you very much for the hats that you've worn for the county, and I hope that you'll enjoy your retirement. So, is there anything else to come before the committee this evening? Okay, seeing none, I'll entertain a motion to adjourn. Mr. Navolanik, second. Mr. Ferris, thank you.
Oh, yeah, well, actually, I assume that. Yeah.
Oh, very cool. I guess that's it.
Mr. Chairman. Mr. Chairman. Mr. Chairman. The way Syracuse has been playing, I really don't care to watch them, but they are,
Would the committee come to order for the December 3rd Finance Rules Standing Committee meeting? I'd like to offer privilege of the floor. Anybody? Seeing no one stepping toward the microphone, we'll deal with the minutes. Any changes, deletions, additions to the minutes from the last meeting? Hearing none, they'll stand as presented. And I don't have a presentation tonight. It was fun to have some other committee do it, and that they had a quorum, so I didn't have to go first. Okay, moving on to the Finance and Rules Committee-sponsored resolutions.
First resolution this evening, and actually the next several are all budget-related, year in and year out, come December. First one, levying 2020 taxes and assessments for annual town budgets.
Motion, please. Legislator Fitzpatrick, Legislator Drake, discussion. Hearing none, all in favor? Opposed? Carried.
Second is levying 2020 consolidated health district taxes.
Motion, please. Legislator Johnson, Legislator Drake, discussion. Hearing none, all in favor? Opposed? Carried.
Levying return delinquent 2019 school taxes. That data will be available at the board meeting.
Motion, please. Legislator McBride, Legislator Cantwell, discussion. Hearing none, all in favor? Opposed? Carried.
Levying return delinquent 2019 village taxes.
Motion, please. Legislator Nabawanek, Legislator Cantwell, discussion. Hearing none, all in favor? Opposed? Carried.
Directing the completion of the tax rolls and the execution and delivery of warrants.
Motion, please. Discussion. Legislator Johnson, Legislator McBride, discussion. Hearing none, all in favor? Opposed? Carried.
Next is authorizing accounts payable year-end adjustments to the 2019 county budget.
Motion, please. Legislator Fitzpatrick, Legislator Drake, discussion. Hearing none, all in favor? Opposed? Carried.
Calling for the organizational meeting of the 2020-2021 Jefferson County Board of Legislators.
Motion, please. Legislator McBride, Legislator Cantwell, discussion. Hearing none, all in favor? Opposed? Carried.
Payment of legislator expenses.
Motion, please. Legislator Drake, Legislator Nabawanek, discussion. Hearing none, all in favor? Opposed? Carried.
Devising premium equivalents for the Jefferson County Government Employees Health Benefit Program.
Motion, please. Legislator Fitzpatrick, Legislator Cantwell, discussion. Hearing none, all in favor? Opposed? Carried.
Approving management compensation plan for 2020.
Motion, please. Legislator Johnson, Legislator Fitzpatrick, discussion. Hearing none, all in favor? Opposed? Carried.
Next is authorizing the acceptance of offers to purchase real property acquired by tax foreclosures but not sold at auction. And there is one adjustment. Which property was that, David?
For the buyer, Diane Nordstrom. She contacted us after this resolution was prepared and indicated she made a mistake in believing a certain shed, I believe, was on the parcel that she thought she was bidding on, and later discovered it wasn't and wanted to withdraw her bid. I allowed her to alter her bid and reduce it to $1 at this point because this program, of course, is attempting to get rid of very small parcels that the county's been holding on to for a number of years because it could not sell them at tax auction. This particular parcel is 0.04 of an acre, and it really behooves us to actually get rid of it even for $1 rather than hold on to it. So if we could have a motion to amend the resolution to change the bid from $250 to $1 for her parcel. Hearing none, all in favor? Opposed? Carried.
Next resolution is amending the 2019 county budget in relation to employment and training department.
Motion, please. Legislator McBride, Legislator Fitzpatrick, discussion. Hearing none, all in favor? Opposed? Carried.
The next is authorizing agreement with the New York State Division of Homeland Security and Emergency Services in relation to cybersecurity grant program and amending the 2020 county budget in relation thereto.
Motion, please. Legislator Cantwell, Legislator Johnson, discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2019 county budget to transfer funds from the workers' compensation contributed reserve to the workers' compensation fund.
Motion, please. Legislator McBride, Legislator Drake, discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2019 county budget in relation to the insurance department.
Motion, please. Legislator Nabalani. Legislator Cantwell, discussion. Hearing none, all in favor? Opposed? Carried.
Appointing members to the Community Action Planning Council.
Motion, please. Legislator McBride, Legislator Johnson, discussion. Hearing none, all in favor? Opposed? Carried.
Then appointing members to Jefferson County Industrial Development Agency.
Motion, please. Legislator McBride, Legislator Cantwell. Discussion. Hearing none, all in favor? Opposed? Carried.
Approving the reissuance by Jefferson County Industrial Development Agency of a $13,145,000 current outstanding principal amount of tax-exempt solid waste disposal revenue bonds, actually Re-Energy Black River LLC, series for 2014, in accordance with Section 147F of the Internal Revenue Code of 1986, as amended in connection with a certain project described herein previously undertaken by Re-Energy Black River LLC.
I was just going to say, the county administrator did give me a lesson on this, so I feel comfortable in asking you for a motion. Legislator Fitzpatrick. Legislator Nabalani, discussion. Yes, Legislator Peck.
Thank you, Mr. Monticelli. Just wanted to have a chance to maybe speak out in favor of the project here that's been happening at Re-Energy. It's within my district. It's been a great asset for Fort Drum and the community, and I just wish to issue my support to the committee on this. But also a question, do we know how many megawatts they're actually producing there? I know it mentions here that it was 60 megawatts as far as a coal plant.
Yeah, offhand, I don't know. They're not at full capacity. That I know, but I really don't know.
2? It is still 60? Okay. Thank you.
Next is authorize the execution of subordination agreement for the mortgage note held by Jefferson County in relation to the Community Development Block Grant Housing Improvement Program.
Motion, please. Legislator Nabalani. Legislator Johnson, discussion. Hearing none, all in favor? Opposed? Carried.
Authorize professional services agreement with VHB for the county's online map viewer.
Motion, please. Legislator Cantwell. Legislator McBride, discussion. Hearing none, all in favor? Opposed? Carried.
Authorize the agreement with Jefferson County Children's Home for the provision of non-secure detention services.
Motion, please. Legislator Drake. Legislator Nabalani, discussion. Hearing none, all in favor? Opposed? Carried.
Authorize an agreement for statewide expansion of the Hurl Herring Grant related to Indian defense.
Motion, please. Legislator McBride. Legislator Johnson, discussion. Hearing none, all in favor? Opposed? Carried.
Employing the state of New York to immediately amend or delay implementation and fail at discovery reform laws that will endanger the people of New York, the shortened version. Not so short, but the shortened version.
Motion, please. Legislator Johnson. Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Carried. Okay, we have one, two.
There are two, if you'd like, we can move forward with the other two.
Yes.
Again, we distributed copies of resolutions to all board members. The first one, authorizing the execution of a subordination agreement for a mortgage note held by Jefferson County in relation to the Community Development Block Grant Housing Improvement Program.
Motion, please. Legislator Nebelak. Legislator Cantwell. Discussion. Hearing none, all in favor? Opposed? Carried.
And sadly, the last one is memorial to Sampy Sutton.
Motion, please. Legislator Cantwell. Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Carried. The next is the General Services sponsored resolutions.
First one is authorizing agreement with the New York State Division of Homeland Security and Emergency Services in relation to the Federal Domestic Preparedness Equipment Program and amending the 2020 county budget in relation thereto.
Motion, please. Legislator McBride. Legislator Fitzpatrick. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2019 county budget in relation to road and road machinery funds.
Motion, please. Legislator Cantwell. Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending 2019 county budget in relation to recycling and waste management.
Discussion? Or, excuse me, motion, please. I guess I'm in a hurry. Legislator Cantwell. Legislator Drake. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2019 county budget in relation to recycling and waste management.
May I have a motion, please? Legislator Nabalonic, Legislator Fitzpatrick. Discussion. Hearing none, all in favor? All opposed? Carried.
Authorizing agreement amending the 2020 county budget in relation to the state fiscal year 19 state law enforcement terrorism prevention program grants.
A motion, please. Legislator McBride, Legislator Drake. Discussion. Hearing none, all in favor? Opposed? Carried.
Authorizing agreements with the Governor's Traffic Safety Committee Stop DWI Crackdown Enforcement Grant and amending the 2019 county budget in relation thereto.
Motion, please. Legislator Cantwell, Legislator Drake. Discussion. Hearing none, all in favor? Opposed? Carried. I'd like to thank you for getting through those. There were some negative... I'm not sure how you did
Negative recommendation.
Yes, so now we have positive recommendations from Finance, so thank you for that. On to the resolutions from the Health and Human Services Committee.
First one is amending the 2019 county budget to allocate additional state aid from the New York State OMH for the Community Services Department.
Motion, please. Legislator McBride, Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2019 county budget relative to mental health programs and authorizing amended agreements in relation thereto.
Motion, please. Legislator Nabalonic, Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2019 county budget to recognize federal Medicaid administration reimbursement for the Community Services Department.
Motion, please. Legislator Johnson, Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Carried.
Amending the 2019 county budget relative to Veterans Peer Support Program and authorizing agreements in relation thereto.
Motion, please. Legislator Nabalonic, Legislator Drake. Discussion. Hearing none, all in favor? Opposed? Carried. There are two informational items attached to your packet, and I would ask if is there any further business to come before the committee? If not, I'll accept the motion to adjourn. Legislator Johnson, Legislator Cantwell. All in favor? We are adjourned.